My name is Tommy Williams. I live in Rockwall, Texas. I am a patient of Dr. Schultz. My journey in terms of understanding PAD started many years ago. I made an observation about a few of my aunts and uncles on my dad's side and my grandfather as well. They were getting their toes and things like that cut off. Back during that time frame, people that had that condition, most people thought that it was something to do with diabetes. I once had a friend in the family who knew my people, and she had made an observation that our folks had been struggling with this circulation problem in their lower legs. And she told me, you ought to get yourself checked. Those were her very words. This had to be 30 years ago, probably more. About 20 years ago, I had my first doctor's visit to check this situation out. It was a cardiologist in Atlanta, Georgia. That's where I'm from. And I explained to him my family history of having the circulatory issues with in their legs and so forth. He did a ABI test for me. He did some other radiographic type analysis and tests as well. And he confirmed that I did have the condition. But at that point in time, I was not suffering any kind of side effects from the condition. I was already taking statins for cholesterol, and my physician tells me that that was the appropriate treatment, for my condition. That was a few years ago, and I never had any problems, with it after that. Here recently, about within the last year, I began to suffer some side effects from the condition. That's when I went and sought out Dr. Schultz, who did some analysis and confirmed once more for me that I did have the condition. He prescribed a series of treatments and medication to control my condition. I was not at the critical phase yet, he tells me, and that there was a lot of things that I could do, preliminary type treatments before I would need any type of the more, drastic, invasive type procedures. And Dr. Schultz has been very helpful in making me aware of the symptoms of the condition. He tells me that my condition is not nowhere near as bad as some that he sees. My advice for anybody who think they have this condition is have yourself checked. And I'll be the first to tell you that a lot of physicians don't really get all excited when you tell them you want to be checked for PAD. I have gone to a lot of physicians, and that condition is not even on the checklist. So I would advise anybody who think they have this condition, runs in their family, or maybe experiencing some side effects, is to get themselves checked by a professional, like right away. There's one last thing that I would say, pass along, that in most cases, people have other conditions that they are having treated. I have high blood pressure, and I did notice that my high blood pressure treatment regime was interfering with my PAD. I was making it worse. So if you have some other condition, you got to make sure that your physicians who are treating it are aware that you do have a PAD, so that the treatment regime can be coordinated appropriately. Thank you.